STDs and STIs are rampaging across the U.S. and especially on college campuses. In the U.S. alone, there are approximately 20 million new cases each year, half of which occur amongst youth ages 15 to 24. Of these, 1 in 4 new STI cases occur in teenagers. STIs usually are spread through sex, vaginal, oral, or anal. STIs can be spread through any type of sex, male to female, female to male, male to male, or female to female. Some STIs will cause very obvious symptoms, but many STIs cause no symptoms or mild symptoms, so you cannot know if you even have the infection. In fact, most people who have an STI have no symptoms. A test from your healthcare provider may be the only way to tell if you're infected or not. College is almost synonymous with partying, hookups, and a hedonistic lifestyle. This results in many STIs and STDs present amongst the common college population. According to Stanford University Sexual Health Peer Resource Center, 1 in 4 college students have an STD. The man standing next to me is an example of this. His name is Yilin. Yilin is a college student who goes to school in the U.S. After a few weeks here, he met a girl he really liked. He dated her for a few months and really never found out much about her past. The common thing to do at IU is to go out and party. Him and his girlfriend were no exception to this. Those first few weeks of college, before they both met, they went to parties almost every single night. Yulin and his girlfriend didn't ever talk about these first few weeks of college. Little to Yulin's knowledge, his girlfriend has become notorious amongst football players and soccer players in a very bad light. From one of his soccer friends, he found out that his girlfriend had sex with 15 people on that first few weeks of schools and had developed maybe some reputation for slutting around amongst the soccer population. And now she has been cheating on him with the whole football team. Yulin decided it was time to take his relationship to the next level. Like any responsible man would do, Yulin wore a condom. He took her out for a nice dinner, bought her a nice glass of wine, and then proceeded to go back to his apartment where he had sex with his girlfriend. A few weeks after this, his girlfriend broke up with him, and then a week after that, he started noticing symptoms such as itching and burning on his penis. Unfortunately, in this day and age, this is very common. We have Dr. Lieberman here, who's an expert on STDs and STIs, to talk about these ferocious diseases ravaging the world. Doctor, based on these symptoms, what could this be?
Well, Zach, based on my expertise in sexually transmitted infections, it is possible Yilin could have contracted trichomoniasis, or Trichomoniasis vaginalis, which is the scientific term. But there's no certain way to tell without going into a clinic for testing.
What is the testing for diagnosis of this disease?
Well, typically a testing technique used for sexually transmitted infections is done by taking a sample of some discharge from the penis or vagina, of the urethra or the canal, and then we take this sample to the lab to perform tests in order to determine what specific sexually transmitted infection has been contracted.
And what are the other symptoms out there that people should be looking for?
Well, some telltale signs that a male has contracted trichomoniasis is either itching, burning, inflammation, and a burning feeling when urinating or ejaculating. In addition, this infection can increase the possibility of contracting HIV.
What are the treatment options out there available for people?
Well, there's one simple treatment option, which is a one-time prescription of an oral antibiotic that is safe for pregnant women that have contracted trichomoniasis to take. Usually, this very treatable infection will begin to subside in a week, but 1 in 5 people will see the infection return in up to 3 to 5 weeks. This bacterial infection can spread to various parts of the body, which is why it is very important to seek professional help when symptoms of trichomoniasis occur.
And what people are most at risk?
As this infection sweeps the country, we can see an increase in prevalence of this infection. There are an estimated 7.4 million new cases annually. College students, who are the main individuals at risk, need to begin to use condoms and other contraceptives in order to reduce the prevalence of sexually transmitted infections in the future.
And as we all know, diseases affect men and women very differently. How does trichomoniasis affect men and women differently?
Trichomoniasis, which affects the reproductive organs, specifically in the urethra of men and in the lower genital tract of women. Women typically feel itching and burning sensations or discomfort when urinating. They may also see a slight colored discharge from the vagina. It is a very serious issue that can occur when women have contracted trichomoniasis, is that premature delivery of a child can occur, which can lead to health problems within the newborn.
Here are the facts about this disease and many other STDs. If you or your friends think you might have one of these many diseases, then contact all your sexual partners and immediately seek health care.
Get the facts, wrap your shaft, because if it fits, it ships.